I'm Dr. Robert Adams from Adams Chiropractic Neurology Group in Sonoma, California, and I want to take a few minutes and just discuss migraine headaches and chiropractic. Migraine headaches are a vascular headache as a consequence to activation of pain receptors in the vascular system in the head area. And the vessels that we're talking about tend to be, in this illustration here would be these blood vessels. This is a view of the base of the brain. This is the back of the head here. And these deep vessels, when they become excessively enlarged, they activate significant stretch receptors. When those stretch receptors are activated, that's where you perceive that throbbing, wah, 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 that goes with the migraine. Also, as a consequence of that increased pain, you're more inclined to want things quiet because that inflamed brain, if you will, doesn't like excessive sounds or sights or things. And if the pain level rises to a certain level, you'll feel nauseated and want to throw up. Now, the migraine headache is actually on the continuum of a muscle tension headache. Some individuals will try to classify headaches in little compartments and say this headache has these characteristics and this headache has that characteristics. In reality, they are in a continuum, and any of them can have autonomic concomitants or associated autonomic or upset stomach, nausea, vomiting as a consequence. You can actually have a muscle tension headache, which isn't truly a migraine, that could make you nauseated. You could also have a migraine headache, which doesn't make you nauseated. It just depends on how things are activated. But typical aspects of a migraine often are some type of a prodrome or some type of what they call an aura, where either a funny smell or unusual sound that you might hear or unusual sight. And what that's about is as that part of the brain starts to be deprived of oxygen as a consequence of vascular constriction, blood vessels constricting too much, then you'll have excessive activity of those brain cells in that particular region. Because that part of the brain has been starved of oxygen, though there will be certain things released, neurotransmitters in that area of the brain, which causes a reflex, a dilation of the blood vessels. And that's where the migraine, the pain comes on of excessive activity. But what causes this thing? What seems to be the trigger? Well, the main thing is that the sympathetic nervous system, or that part of the nervous system associated with fight or flight, becomes overactivated and is not adequately inhibited. So what typically activates that may be a stress trigger. Often, because stress does what to the sympathetic system? It makes it overactive, right? Or it may be a nutritional component, a stressful food or something that is stressful to the system that causes some capillary dilation aspect. Or it could be pain. Pain activates the sympathetic nervous system. But once a certain threshold is met of activation, that causes those blood vessels to become constricted, the sympathetic system becomes overactive, those vessels constrict, and then they rebound, dilate. So how can chiropractic help with a migraine headache? Well, two ways. One, a specific adjustment to the neck can activate movement receptors, which when they're activated actually inhibit pain. Also, as we activate more movement receptor activity, we stimulate higher brain function, which can calm that sympathetic system by activating the parasympathetic system to bring that down under control. Also, the adjustment can stimulate better movement around a joint, which causes more fluidity of the tissues and get some of the congestion and irritability out of the area. Also, as chiropractic neurologists, we're interested in looking at the overall system of finding out where certain parts of the nervous system may be underactive, allowing the sympathetic nervous system to be overactive. And so we can find what we call hemisphericity patterns by evaluating the patient very carefully and making the determination. So chiropractic has been shown to be very helpful in preventing and correcting migraine profiles.